Hi everyone, welcome back to our channel. You've probably heard of Kegel exercises before, but how do you actually do it? And are they just for women? Today, we're going to be talking all about Kegel exercises for men. Yes, you heard that right. Men need these too. If you've ever wondered how to improve your bladder control, support your prostate health, or even improve performance in the bedroom, this video is for you. We're covering what Kegel exercises are, why science says they work, who should be doing them and who shouldn't. And stick around, because we will walk you through exactly how to do Kegels the right way. Disclaimer: before we begin, the information in this video is for educational purposes only and is not a substitute for professional medical advice. It is not a cure and should not be replaced with medical treatment or advice. Always consult a healthcare professional before making any significant changes to your diet or lifestyle. What are Kegel exercises? And why do they matter? Think of your pelvic floor like a supportive hammock or a bowl of muscles, stretching from your tailbone to your pubic bone. These muscles, especially the pubococcygeus or PC muscles, help support your bladder, prostate, and rectum. They're essential for holding in urine or stool, having strong, reliable erections, orgasm and ejaculation, and believe it or not, even for core stability. Kegel exercises are simple movements that target and strengthen these pelvic muscles. They were first introduced in 1948 by Dr. Arnold Kegel to treat urinary leakage in women after childbirth. But here's the thing: men benefit just as much. Over time, these muscles can weaken from aging, prostate surgery, diabetes, or injury. When that happens, it can lead to erectile dysfunction, ED, premature ejaculation, urinary leakage, especially after prostate surgery. What does the science say? Let's look at a few studies. A 2005 randomized controlled trial tested pelvic floor exercises with 55 men who had ED. One group got exercises and biofeedback, that's when sensors help track muscle activity. The other group only got general lifestyle advice. After 3 months, the group doing pelvic floor training showed significantly improved erections. And after 6 months, nearly 40% had regained normal erectile function. They also had less post-urination dribble. You know, that little leak that can happen after you think you're done. But here's the catch: about 40% of participants dropped out of the study. Why? Because like all exercise, these take time, consistency, and effort. Many people give up before they see results. Another study in 2019 review of 10 studies found that pelvic floor exercises improved both erectile dysfunction and premature ejaculation. In one trial, 47% of men were completely cured of ED when the exercises were paired with biofeedback or electric stimulation. In another, men increased their ejaculation time from just under 40 seconds to over 2 minutes. That's a big difference. When are Kegels most prescribed? Urologists often prescribe pelvic floor training after a prostatectomy, that's surgical removal of the prostate. Many men experience some urine leakage after surgery, especially when coughing, sneezing, or lifting. Research shows that doing Kegels with guidance from a pelvic floor physical therapist offers the best results. Think of it like going to the gym with a personal trainer is way more effective than going alone by yourself. Who should not do Kegels? Not everyone is a good candidate. If you have pelvic floor dysfunction, Kegels might actually make things worse, meaning not you. You might have dysfunction if you have chronic pain in your pelvis or genitals, pain during orgasm, erection, or ejaculation, ongoing constipation, or frequent, urgent urination. Also, if you recently had surgery or urinary tract infection, talk to your doctor before starting. How to do a Kegel. Hello guys, to help men improve erections, stop leaking, and build confidence, let us go through exactly how to perform a proper Kegel. Step 1. Find the right muscles. For most men, the pelvic floor is a mystery. But here's the trick: the muscle group you're trying to engage is located in the area just beneath your scrotum called the perineum. To locate it, sit on a chair and slide to the edge so your penis and scrotum hang off the front. Take 2 fingers, index and middle, and gently place them over your perineum, the area between your scrotum and anus. Place your other hand on your knee and relax. Take a deep breath in and out. Now, you're set. Step 2. Learn to contract. We can't see these muscles, so we need a mental cue. Try one of these. Cue number 1. Stop the flow. Imagine you're urinating and suddenly need to stop the stream. That subtle internal lift is the pelvic floor contracting. Close your eyes. Take a deep breath in. Exhale fully. Now, stop the flow of urine. Feel for a gentle flicker, tightening or bulging under your fingers. Then relax. Let's try it again. Breathe in. Breathe out. Stop the flow. And relax. Cue number 2, cold water shrink. Still not feeling it? Try this mental image. Imagine stepping into a freezing cold ocean. As the water hits your scrotum, your body reflexively lifts everything up and in. That's your pelvic floor contracting. Say to yourself, lift your nuts to your guts. Weird? Maybe. But effective? Absolutely. Step 3. Start slow, quality over quantity. When starting out, aim for 10 quick representatives a few times per day. Think of it like flipping a switch. Squeeze, release. Squeeze, release. No long holds yet. That comes later. Don't clench your abs, thighs, or glutes. And keep those fingers over your perineum to feel what's happening. Eventually, you'll progress to longer holds, standing representatives, and more advanced exercises. But start simple. The bottom line, Kegels can improve erectile function, ejaculation control, urinary leakage, and maybe even orgasm intensity. But like any exercise, they only work if you stay consistent. Do a little every day, morning, afternoon, and evening. Be patient and give yourself time. Alright, having said it all, remember the information in this video is for educational purposes only and is not a substitute for professional medical advice. It is not a cure and should not be replaced with medical treatment or advice. Always consult a healthcare professional before making any significant changes to your diet or lifestyle. Final thoughts. If you want more advanced pelvic floor workouts, let us know in the comment below. Guys, if you haven't already, hit that subscribe button. It's free, and we've got so much more content coming to help you take care of your health and your performance. Take care of your health because it's worth it.